She had told me that her whole family got COVID. She was the last one to get it. She seemed to have it in a worse case than the others. I was worried, and I contacted Chip, my brother, who's retired MD.
The amount of oxygen she required was dangerously high, meaning that her oxygen level was dangerously low.
In the 2 years of the corona pandemic, we've experienced shutdowns, quarantining, both public and private, masking and social distancing in our struggle to deal with the virus. The one constant has been the high mortality rate amongst 1 to 2% of the infected population who require hospitalization. When the infection rate causes thousands of people a day to become ill, that 1 to 2% floods the hospitals beyond their capacity and causes hundreds of deaths weekly. At first, doctors believed that COVID caused a sudden, massive collapse of lung function because patients with few or no symptoms suddenly could not breathe without the help of a lung ventilation machine.
The doctor came in, he said, "Hey, I've got some bad news. You've tested positive for COVID-19. And it was actually very shortly after that I started to lose lung function and they intubated me. I was actually in a medically induced coma for 3 days. And then during that process, they put me on a ventilator where I spent 7 additional days.
Dr. Richard Levitan was the first to write about his observations on COVID patients. Dr. Levitan was also the first to publicly advise people to use a small, inexpensive, commercially available pulse oximeter to monitor blood oxygen levels if they were diagnosed with COVID.
For more on the treatment of COVID patients, let's bring in Dr. Richard Levitan. He's an emergency physician at Littleton Regional Hospital in New Hampshire. Back in April, you recommended one of those oximeters for people to check their oxygen levels.
The best chance that patients who develop COVID pneumonia have is to come into the hospital early before their oxygen saturation falls. So I recommend that everybody who tests positive for COVID be monitoring their oxygen levels and be in touch with their doctor if they see that number fall below 93%.
The pulse oximeter reports oxygen saturation, SpO2, and heart rate, HR. Hemoglobin in the blood carries oxygen from the lungs to the cells in our body. It exists in 2 forms. Here are 2 molecules, one without, called deoxygenated hemoglobin, and the other with, called oxygenated hemoglobin. SpO2 is the percent of hemoglobin in the oxygenated form. This shows 10 hemoglobin molecules with different values of SpO2. Those numbers really mean something and can spell the difference between a short stay in the hospital or weeks and even possible death.
And I told my boss, I'm going to New York to help out. And I spoke to my friends who were there, other emergency physicians, and they said, it's crazy. These people come in with very low oxygen saturation, but they're on their cell phone. And the numbers that these people had in terms of oxygen saturation was seemingly incompatible with life. Some people started calling them happy hypoxics or happy hypoxemics. But the reality wasn't they weren't happy. Their lungs are working hard and they're actually dying. So I thought the term silent hypoxia was better because they had minimal symptoms and their oxygen was getting severely low. Now, my experience from high altitude climbing, I had seen this before at 20,000 feet. If you're at 20,000 feet and your body's learning to acclimatize to severe hypoxia, you increase your respiratory rate. You can get to pretty high altitude levels and you'll be conscious, but your oxygen will be low. When I wrote my piece in the New York Times about this, it was about the fact that this must have developed over days, that these people got there. And that was the sort of aha moment that, wait a minute, we could determine when it starts if we used pulse oximetry.
Sherman Rosenfeld's daughter, Adi Rosenfeld, was a classic COVID case right out of Dr. Levitan's description.
She had told me that her whole family got COVID. She was the last one to get it. She seemed to have it in a worse case than the others. She had 4 days of fever. And at that time, I was worried, and I contacted Chip, my brother, who's retired MD.
We were in a conference call, and she says, I feel horrible and I've got a fever. I said, well, chicken soup. No, I said, that's part of it. Fluids and as best you can. Take some Tylenol for your fever and aches. And of course, get an oximeter. And she said, famously, what's an oximeter? And her dad said,
I said, what's an oximeter and why should I get one? So he sent me the article by Richard Levitan. So I went out and I bought the oximeter in the local pharmacy. And so I brought it to my daughter. I put it in the battery and I tested it out. Very simple way to use it. I told her to measure it consistently. And if her measurements went down below 94, that she should call me. And then she was feeling great. And one night at 11 o'clock, she calls me and says, Abba, I'm feeling really good, but, you told me to call you if this oximeter thing goes down, down past 94. Well, it's actually past 90. It's at 89. And I said, hey, this is serious. You should get to the hospital. She said, why? I feel great. I feel fine.
I talked to Sherm. I said, listen, this is the reason why you have an oximeter. The reason you bought it is to check for this precise reading in the absence of symptoms. This is why you have it. This is the warning sign that things could be worse.
At the end of the day, she decided to go, even though she was feeling great. And then of course, she got to the emergency room and they said, you're going to stay here. We're not going to let you go. Your lungs are being attacked by the virus.
The main reason to go there in this setting is to confirm that the consumer grade oximeter is actually accurate. It's not a medical grade device. We acknowledge that. But it is surprisingly accurate in the normal range. And it's also accurate in telling you when it's abnormal.
And so she stayed that night. And the next 3 days, as a matter of fact, she was in emergency care.
She described her oxygen being delivered by facial mask. The fact that she required facial mask oxygen means the amount of oxygen she required was dangerously high, meaning that her oxygen level was dangerously low. And thankfully, that and steroids, which was given, was enough to turn the corner, and she ended up being discharged from the hospital in 3 or 4 days.
We caught it just in time.
The importance of the oximeter is so well known. Where are the health authorities, beginning with the Israeli HMO?
We started looking at the HMOs in Israel. There are 4 of them. We found that one HMO, they do very well. They give out oximeters and they tell people how to use it. One of the 4 doesn't do very well. It doesn't give out oximeters at all. And the other 2, and this includes the HMO that Adi was in, the other 2 basically give out oximeters, but they don't tell you how to use them, or at least it's not on their website. We found out later that in these 2 HMOs, they actually do tell people how to use it, but they only do that over the phone. And apparently, in the case of Adi, there was there were a lot of people who had COVID during that time, and the operators didn't get to her, didn't talk to her.
The UK is another country whose public health system has completely embraced home monitoring with pulse oximeters for COVID patients.
That's why we need you to monitor your breathing, your heart rate, and the level of oxygen in your blood. By recording these measurements in the diary provided, you can help your GP or 111 decide on the best treatment for you.
I'm still puzzled by the response of the health authorities to all the data, because the data is overwhelming.
The challenge of getting universal pulse oximetry is public education, as well as public health messaging communication. We need to, as a globe, appreciate that in this day and age of medicine, that a pulse oximeter is way more useful than a thermometer. Having that oximeter saying, here's my heart rate, here's my oxygen saturation, it's becoming pivotal.
The fifth wave of corona has already begun with the Omicron variant, and God knows what variant will come after that. If 10,000 people a day start to get COVID, 200 a day will need hospitalization. If you get COVID, God forbid, how do you want to end up? Like this, in the hospital for 3 weeks, or like Sherman's daughter, Adi, who spent just a couple of days in the hospital and then was able to leave after getting a little bit of treatment. This device could be the whole difference, nothing to it. It's not expensive, it doesn't hurt, it doesn't take any time, and it can save your life, the life of somebody in your family. There are 3 studies showing the effect of using home oximeters on the results of patients that use them versus those that don't.
And our public health messaging has not kept up with the complexity of COVID. And the public is unforgiving.